Hi, good morning, Dr. Shweta. Can you hear me properly?
Good morning, Dr. Hafiz. Yes, we cannot see you.
We can hear you.
You can see me now, right? This good? Oh, you can see this. Can you remove this one? Can you remove this one? The background. See the background? I have this because last time when I was using Zoom, there was some setting. Change the setting. Dr. Shweta, can you see my background?
Yes, Dr. Hafiz.
You can see me?
Yes, very much.
Maybe I'm not able to see myself.
Good morning, everyone.
Good
morning.
Good morning, sir.
Good morning. All the best.
Thank you, Dr. G. Thank you so much. As you've got
Yes, Fatima, is everything audible? Can you hear everything clear?
Can't see. Ladies and gentlemen, good morning and welcome to our 8th webinar. Now, this one is SARS-CoV2 testing, vaccine immunity, and we discuss myths and facts. I got up this morning to see a newspaper report on our webinar in which the reporter asked the following questions. 1, how long does the vaccination protection last? 2, why do people catch COVID even after the vaccine? And 3, do our current vaccines protect us against all COVID variants? Now, these are just a few questions that have come out in the newspaper this morning. It was questions asked of us, and there are several more that have been flowing in. Now, in order to answer these questions, we have a scientist. He is a professor in microbiology in Iraq Medical Health Sciences University. He will give us the facts about testing, vaccines, and immunity. And then we would have our very own Director of Medical Services, who is a neurologist, who will present to us some myths and clarify the facts. So now we start with our first speaker. We have Dr. Hafiz on screen. Ladies and gentlemen, my absolute pleasure to present Dr. Hafiz Ahmed. He is an assistant professor of medical microbiology and clinical microbiology in the Iraq Medical Health Sciences University. He is also the head molecular microbiology at our own Iraq hospitals. Dr. Hafiz did his PhD studies from the very prestigious AIMS in India. And then he went on to do a doctoral fellowship from the National Institute of Health in the United States. He also did postdoctoral training in molecular microbiology in Germany. Dr. Hafiz is a star speaker in over 80 regional and international conferences. And we are turning to Dr. Hafiz to help us to understand testing, vaccines, and immunity. Dr. Hafiz, we are at your disposal.
Thank you, Professor Kennedy, for the warm welcome, and that's really encouraging for me. Can you hear me, Dr. Kennedy?
Not at all.
May we request all participants to kindly mute themselves, please. Mute yourself right up to the question and answer session. Just leave the floor to our speakers, please. Thank you so much.
Dr. Kennedy, thank you for the warm welcome. Can you hear me? Can everyone hear me?
Yes, we can hear you, Doctor.
Thank you so much. And it's a pleasure to be part of the webinar COVID Beat. And I think great initiative by the Iraq Hospital team from Sir Dr. Gower, His Highness, and definitely it will, inshallah, help the community. And the whole idea is to bring back the community and give the confidence that the testing, the vaccination, and the steps we're taking for them are safe. So it's a little elaborate lecture because we would like to cover testing, vaccines, and herd immunity. And I will just try to be a little quick, and later Dr. Shweta will cover what I cannot cover, may not be able to cover, and we will discuss over these topics. So we all know COVID-19, and I think many of you may know better than me that this virus is a single-stranded, RNA virus. But what makes it positive is that the strands, we have positive strand and negative strand viruses, and positive strands viruses are relatively easily transcribed to, and the proteins are made faster. And also what is important as a public health person is we should know that the virus is easily killed by soap and water because it has an envelope. And this envelope gives the property, so a soap and water is the best solution for killing this virus. And that's the beauty, and that's what we're advocating with 20 seconds of soap and water definitely keeps you away from COVID-19, and also you can safeguard yourself. Just as a quick statistics to the vaccine and why is it so important, we will discuss this point. So currently, as of July 1st, we have almost 5 abandoned vaccines, 9 vaccines in the early phase, and almost 70 plus vaccines which are there in the phase 3, phase 1, and phase 2. So we have a plethora of vaccines, but of course the government has chosen the best vaccines for us, and we'll come to the some of the vaccines which is the new vaccines and what we are doing. So alhamdulillah, by God's grace, UAE, we are blessed to be in UAE under the leadership of our leaders, and we are having a very high success, very high vaccination status. If you see, we are in the green zone, and we are almost 33.8 million people have been fully vaccinated with double doses, and the almost 40% single doses, and 70% of the population is being already vaccinated. So we are doing it very nicely, of course, with the help of the support of the participants. Just to come a little bit of virology, and if it gets complex, we can just explain later. So we need to understand the virus as a spike protein, and the spike protein is the protein which is the most interesting part of the virus, which binds to the receptors ACE2, which are present on the epithelial cells or lung cells or the kidney, these cells, and they are the one which is causing the pathogenicity. And therefore, we should always remember the S protein is the key molecule with respect to the virus. And then we also have a nucleocapsid protein, which is there a little inside, which tells us the exposure of, if you are exposed to the virus, you check the nucleocapsid protein, whereas the the vaccination status you can only get by a spike protein. So this should be very clear with us, because there's a lot of confusion which still needs to be understood. So the spike is the main protein and the antigen which the virus evokes, and it also has 2 subunits, the spike protein, which one of the subunits is the one which is binding to the receptor, and the one which is fusing. So there are a couple of kits which gives both 1 and 2, and there are some kits which only give S1. So we will discuss in detail, little more detail, what is the relevance of using both or just one. So remember, spike protein is the main protein by which we get the anti-spike immunoglobulins. And there is a new test also which is called virus neutralization test, which goes in combination, to the vaccine strategy. So if you would like to know your status of anti-S protein, you should also have a look at the how much of the virus is being neutralized by your plasma or by your cells. So this is also important. So this combination can give you an answer, especially in immunocompromised people or people who are debilitated and would like to know or frontliners like us who would like to know their status of how much protection we have. These tests are available, and of course, alhamdulillah, we are also doing these tests. So for COVID, let's remember one thing: timing matters. Because if you don't time your test properly, then definitely you're missing the virus. False negatives, false positives. There are many, these terminologies will come to you again and again. Therefore, for antigen testing, antibody testing, PCR testing, what is the key is timing. So let's remember that we need to be sure that all these antibodies, they have a basically timing. So the first you have the virus which comes up, so you get positive in PCR, but then the virus drops down, and you will get, if you check after 10 days or 12 days, you may get a remnant of the virus, and then your culture is only active till CD24 or less than. So if you're checking the virus continuously, you may get a dead virus. But at the same time, it's advised that you do an antibody test, because antibody tests after 1 week will take onset. And this is the test which will remain. Basically, you can detect the person is protected, or if he's infected, or if he's cured by the antibody testing. So this is just a little bit of dynamics of the virus and the antibody testing. We have a lot to cover. I will just go quickly. So let's understand that the timing matters when you test and what test you do, because the interpretation all depends on this timing. There are a lot of tests in the market: ELISA test, CARD test. So these are the rapid CARD tests where you have the antibodies are already impregnated on the basically a membrane, and then you detect if your plasma or your blood has antibodies, it will bind and conjugate and give you the reaction. So you have an ELISA, enzyme limb immunosorbent assay. So if you coat your plate with the antigen, you can detect the antibody if it's there in your blood. And this is the test which is done most of the laboratories. The gold standard, however, is the plaque neutralization test, which is little harmful, and only laboratories which have BSL 3+ or high grade containment can only do this. So most of the labs in UAE, except maybe for G42 or some reference laboratories, do not do this test. So we only rely on ELISA or antibody testing. And it appears that anti-spike titers are, especially the IgG titers, are good enough to give you a interpretation of vaccine protection. Again, the same thing here. I would emphasize that the nucleocapsid protein gives you the exposure. If you want to check whether you're exposed to the virus before you can check the nucleocapsid, but it doesn't tell you anything about your protective immunity. The protective immunity is only because of spike protein, and this should be very clear with us that spike protein is responsible for protection, whereas the nucleocapsid is only for exposure. So this is a routine graph which is in a person who gets positive, and especially in a person who is critical, will have more antibodies. And this is what the literature tells us. If you are having more severe disease, then you will have more antibody production. And that's why the convalescent plasma therapy, did not take much ahead, because the only people who had higher antibodies were the people who were in ICUs or have critically an asymptomatic person may not develop that much of antibodies. So this is the just to give you an idea, the timing of antibody response, especially 1 to 2 weeks is the timing, and you get you can measure your antibody status, especially if you are your immunostatus based on this. And we also should know that IgM is not the is not the indicator of because it stays only for a few weeks, and you have IgG only, which is remaining. One good concept which has come of late, what they say is protective immunity, is that once you are taking the vaccines, it's not just your plasma cells, which are the earlier cells, but you have long-lived plasma cells, and these long-lived plasma cells continue to give the body antigenic exposure, and they continue to make antibodies for you. So there is not just an antibody component to your protection, but also there's a cell-mediated component, and that's very critical. So therefore, a person who just cannot measure antibodies and say I'm protected, he also needs to measure his T cell response, and because you have a memory cell repertoire in your body, and that repertoire is activated by these long-lived plasma cells to give you continuous protection. So the role of neutralizing antibody basically is it's multifaceted, and also there is complexity of non-neutralizing antibodies, neutralizing antibodies, and because neutralizing antibodies leads to the loss of infectivity and block the virus. That's why it's very important for us to measure the neutralizing antibodies, especially if you want to know the protection levels. So I don't want to make it complex, but just to give you an idea that neutralizing antibody is very important for protective immunity. Also, antigen testing we do at RAG, and the only disadvantage of antigen testing is if you use a transport medium or a VTM which is different, then it gives you a false negatives. And this is our experience at RAG, that if you do the testing with the same VTM or the same swab and the same machine, then it gives a better result. the UAE has come up with updates of guidelines, and if anyone interested can go through these serological testing guidelines version, and they have a flow diagram, clear-cut flow diagram as to how you can benefit from this serological assays. And just to give you an idea that if you're you can go through these guidelines. And anti-spike estimation post-vaccination is a key, especially the S1 domain of the spike protein, which gives a better correlation than both S1 and S2, because S1 and S2 can cross-match, cross-react, and give you basically a reading which may not be so precise. So there are many kits, and I don't want to go into the commercials, but yes, and I have no affiliation with these, that's a disclaimer from my side. But yes, as per scientific evidence, S1 domain works better for vaccines work. Just a quick review of how vaccines work. Vaccines basically they reduce the risk of infection by training our immune system to recognize and fight the pathogens better. It can be a bacteria, it can be a virus, but it elicits an antigen, basically, which is foreign to the body, and then it evokes an immune response. And a vaccine can be understood through different routes. It can be muscular, it can be oral, it can be intradermal, and it gives you a boost. Sometimes a booster is required to just when your immunity wanes down. And that's the question comes to when you say, how long am I protected? So now, we have literature that till 6 months antibodies are persistent, and I can just show you some slides on that. So there are three approaches basically to make a vaccine. It can be a live virus, or it can be a kill virus, or it can be just the DNA or RNA of the virus, just the DNA makeup. Just a very crude slide, just to understand that it can be either of these, and either all of them check, evoke your different parts of the immune system. It can be a kill virus, which is inactivated by some reagents, or it can be a viral vector vaccine. Sometimes you have adenovirus or other systems of vectors which can deliver the vaccine and evoke your immune response. But it doesn't integrate in your genetics. It has nothing to do with your chromosomal DNA. It is just evoking an immune response. So the myths Dr. Shraddha will cover, and which will say that some people say that it may integrate into your host genome. It doesn't integrate. It just evokes an antibody response, and which is evident, and it gives you a protection. So there are different types of platforms, different types of vectors, and different types of vaccines which are coming in the market. And I don't want to go into detail, but at the end of the day, we should understand that all these have high sensitivity and specificity of 70 to 80% protection. And if you are taking these vaccines at dual dose with the government guidelines, whether be it Sinopharm, be it Pfizer, or be it the Indian vaccines, Covax or Covishield, they offer the same level of protection. And why? There are questions asked, why is it, some people would say, never happened. In 10 years it takes to develop a vaccine. Why would you develop a vaccine with just 1 year? Because all these preclinical stages in phase 1 and phase 2 and phase 3, they run parallel. They are, because when you have emergency authorization, all these systems, all these forces of vaccinology run in parallel. And that's why we were able to get the vaccines so quick and so early. And that's the beauty of science and our scientists who have been on day and night on this. So all these 4 phases where you have different categories of individuals, safety and efficacy, nothing is compromised. But yes, all these phases have been done at the same time parallelly to give us vaccines which are coming, the candidate of vaccines or the trials, they have been very much fast. So we have just a quick glance of Moderna, Oxford, AstraZeneca, Sinopharm, which is here, and then the Sputnik also, which is being trial and tested in Abu Dhabi, especially the mix and match approach. We will come to it later, but these are the vaccines, and they offer possibly a very high protection efficacy levels, because the protection is not just for the vaccine. The protection depends on the immune system. How a Sinopharm vaccine affects, it boosts your immune response would be different. How the same vaccine boosts my immune response, and that's why we need to. We need to generalize it. We cannot say it differs from person to person. So, but at the end of the day, we should understand that it's all safe. It has gone through the procedures in place, and there's no such adverse event. If you ask your colleague or someone and ask how many people have died of vaccines, you may hear 0 number. And that's the trust and we need to build them in the community. So it's a safer way. Vaccines will help you protect your body immunity without the risk of severe infections, severe infection. So if you're vaccinated and you get a COVID, most likely, inshallah, you will not land up in ICU or have oxygenation issues, but you will basically, and that's the whole idea of the government, vaccinate everyone so that you have a good immunity. This is one of the papers which is really recent, and if it answers the question, how long are you protected? So if it's, they have done the research and they found that the memory cells are there more than 6 months, infection, post-infection, and they basically tell us that though the immunity wanes down, but still 6 to 8 months we are protected. So the key facts of vaccination, what we should know is that get vaccinated and take help. And people who are already sick, may still get vaccinated. There's a time period of 3 months, a buffer period, but you can still go and you take the vaccine because it doesn't harm you. It doesn't, it offers you protection if nothing else. So will not cause a vaccine will not make you positive. There are notions that people say that I took the vaccine and I got positive. It's not because of the vaccine. It's because of maybe a COVID, a new virus, a new strain, which is coming in the domain. So the whole idea is to, get a herd immunity. And how do you say, if you see the graph here, if you're not vaccinated, then most likely you will be transmitting the virus. If you see what you call R0 is the number the virus multiplicates. And it multiplicates to, if you're unvaccinated, it goes this proportion. And if you are vaccinated, the community vaccinated, the orange numbers will go down because there's a herd immunity in the population. And that's the whole idea of the governments, to establish a herd immunity. No matter how much variants come and go, the idea is to make people protected using high vaccination protocols. If you see, there's a good paper which has come, and the Israelis have done a very great job, especially in terms of vaccinating the whole population. And if you see, in people who are vaccinated, the incidence has gone very low, almost 0.02 or 0.0 levels with respect to the people who are not vaccinated. And that's the key message we have from them, is that take vaccine and prevent. And if you have hesitancy, there are guidelines, and there are any delay in acceptance or refusal of vaccine, despite the availability, is called vaccine hesitancy. And there are a lot of social, sometimes, WhatsApp messages, sometimes our own thoughts and our colleagues, give rise to these thoughts. So most likely, a lot of surveys which are done worldwide, and most of the people still believe that overall say that vaccines are safe and efficacious, and that's why it should be advocated. So if this is just one of the papers which says, why are you not taking a vaccine? What makes you hesitant? So 67%, has concerns of side effects, or sometimes they believe that, it doesn't affect. See the blue bars, almost 40 to 50, 60% just say because of side effects. But if you see in reality, side effects are literally minimal. And those side effects may be because of our own immunity, of our own antibodies. There's a concept which has come lately, it's called autoantibodies. So if I'm immune sensitive, my body has autoantibodies against any vaccine. And I may have an allergic reaction to the component of the vaccine, the preservative or the propiolactone or those buffers. It's not the vaccine which is causing this. So just some of these, I don't want to go in much in detail, but at the end of the day, we need to know that most of these vaccines are approved and they are safe. And some people would come to the fact that why some of these vaccines are causing blood clots. But at the end of the day, if you understand with this very crude picture, is that, the infection with vaccine, the incidence is 0.000 times 4 than any other infection, maybe smoking or something which without vaccine, you are 16.5% more likely to get infected or get a blood clot than just getting a vaccine. So these are all myths, and this has to be bursted. I think Rashada will shed more light on this. But at the end of the day, we need to understand that these vaccines were they were tried and they're tested, and they offer long-term safety. Especially, we need more data as we grow up in the COVID, and we need to believe in science, and that's the message. So a new concept has come up for the mixing vaccines, and I think there is a trial going on Sputnik and AstraZeneca in Abu Dhabi, and also they are recommending that after Sinopharm 2 doses, you can take 1 dose of Pfizer. So this is but there's still data to be out in the community so that we get more. But of course, we have a scientific. There's no there's no adverse reaction so far. What we have seen. One point also we need to understand here is that since the variants are very rapidly, they're smarter, and the virus is smarter enough than us and evolving much faster. Therefore, it impacts the diagnosis. And there's something called as vaccine escape mutations. So even though you're vaccinated, maybe twice or 2 doses or maybe a booster, still you may have vaccine escape mutations. It's a very nice study from where I studied AIMS, and they've burned the fact that these escape mutants, especially can occur in people who are elderly, people who have a low immunity, and therefore sometimes it's good for people in this category, immunosuppressed, cancers, diabetes, to also know their antibody status so they can monitor themselves. So it may not be a protocol to do antibody testing for everyone or neutralizing antibody for everyone, but yes, it is good for if you want to know your. So this is our lab, which started in last March, thanks to our leadership. And I'm thankful to everyone for patient listening. In the RAC hospital, we have, alhamdulillah, almost 500,000 tests we've done for COVID. We do routinely a spike IgG and neutralization. We're the first ones to launch Bamlavir and also Regeneron. And we also now testing for COVID variants, and inshallah, sequencing project is also in pipeline, and it has got approval from the US. Thanks to Dr. Raza, Dr. Kaur, Dr. Shweta, and our team of 24/7. The team on behalf of whom I'm speaking here is really critical, and I owe them to them. Thank you so much for your patient listening.
And thank you. And thank you, Dr. Hafiz. Now, I need to choose my words very carefully. I've heard your presentation, and in the end, I come out with a feeling of gratitude. I am so grateful for the information you have given us. You have, at any rate, given me a sense of comfort, and I am not only proud, but also delighted with your expertise, and so happy to have you in our team. Thank you so much, Dr. Hafiz. That was fabulous. Thank you.
Thank you.
And now, ladies and gentlemen, we have our most popular and perhaps our most brilliant speaker. And that is our own Director of Medical Services, Dr. Shweta. Now, Dr. Shweta is not only an excellent neurologist, but she is also an excellent speaker. She has done her MD in medicine, her DMB in neurology, an FACP from the USA, and to top it all, has done an MBA from Cambridge in the United Kingdoms. She's a specialist in neurology and the medical director over here. Now, Dr. Shweta has not only worked with us, she has worked in Canada, worked in South Africa, the continent, the Middle East, and also in India. She has presented over 40 scientific publications and is the author of 2 books. And to top it all, she's been extremely busy, and she is extremely competent in her utilization of time. She has conducted over 200 workshops across institutions and universities. Dr. Shweta is now going to enlighten us on the various doubts that we have. For example, can a pregnant or a lady who is lactating and breastfeeding take the vaccine? Is it safe? Well, there are so many such questions that have come up, and I'm quite sure there is no better person than Dr. Shweta to help us to bust these myths. Dr. Shweta, the floor is yours.
Thank you. Thank you very much, Professor. Thank you to the whole team of RAC Hospital COVID webinar series. This is a fantastic initiative. Dr. Gavar, Dr. Raza, and thank you for inviting me today. This is a very, very important topic because I think, let me just fix my slides before I move on. Dr. Wilco, just let me know if my slides are visible.
Yeah, ma'am. Perfectly.
Yeah, visible.
Perfect. Okay, super. So this is that all of us, this is the thing that we want. We want to be again free. We don't want any travel restrictions. We want to put our masks off. We want to live a normal life again. Put it in the chat box if how many of you would like to have this picture as your own, right? I think each one of us here is praying, is trying hard, doing everything to get to this stage. When will we get to that stage is very, very important. And what are the things that we need to do to reach to this stage is also very important. And vaccine is one such important thing in this fight against COVID-19. So today I will just lead you to Dr. Hafiz did a talk, a lot of, he covered a lot of things about the antibody, the vaccine type. I'll just carry on the discussion and talk individually. If you have certain problems, can you take the vaccine? What are the myths associated with the vaccine? And of course, we will keep the mic open for a lot of question and answers individually. If you have some question pertaining to your vaccination status, please put it in the chat and we'll be more than happy to answer. Now, COVID update, this is the thing that Dr. Hafiz also talked about, how many cases. We have been following this for last about 15 months now. But the point is, why are we following this data? Why do we need to look at how many people got infected, how many people got vaccinated? Because this is only going to be the game in the end for pandemic. Either majority of the people get infected, which is not what we want, or majority of the people get protected against the COVID-19, and which is only by vaccine. So what I've shown here is the current 183 million odd cases, roughly about 3.9 million deaths. But on the right is a very important figure. What percentage of population has been vaccinated? Now, vaccine is not new for us. Tuberculosis, smallpox, measles, mumps, you name it, and we have fought all these diseases with vaccine. So per se, the concept that once you take the vaccine, what you are doing is you're fighting against the virus. You are producing some, what they call as antibody. Antibody is nothing but, for example, this is your COVID virus. You are making sure that it's not affecting the body and it's capped. And it's capped with something called as antibody. So this is your antibody and this is your COVID antigen or the COVID virus. So this is not an old concept. We know the vaccine for many, many years. Now what we need to know is about the COVID-19 virus and the vaccine. Now, first of all, very important to know, and this is for everybody, who is at high risk for COVID disease. This is a very important thing to understand. And that is why it's important also to know that these are the people who must, I'm repeating myself, who should and who have to take the vaccine, okay? So people who are above the age of 65, people who have diabetes or sugar, people who have high blood pressure, people who have problems with heart. I'm seeing in the chat, somebody has written, I have heart problem, I have cancer in the past, I have arthritis, I have problem with my joints, I have other immune diseases. You name a disease and you have the chance of getting more infection because your body cannot fight, because your body cannot produce these antibody, which is capping the antigen. You are supposed to be the first in the line to take the vaccine. So first thing is you are at high risk because of these underlying problems and you should be the one to take it. Now, there is also a second group of people who have to travel, who get exposed because they're living in a community setting, who are adolescents. Now, remember that the virus started to attack the old and then it changed its form. It is essentially also seeking to survive, and it can only survive once it attacks a human body. By itself, it will just die. We know that it dies on a paper after 3 days. It dies on a surface after 3 days. it also needs to be inside somebody to replicate, to grow itself. And that happens only when it finds somebody where it cannot attack. So, and that is the reason why the new variants, the new changes which are happening is affecting younger people. Even children are getting affected. Even people in the 20 to 40 years age group is also being affected. When we started with the pandemic, yes, it was the old people who bore the brunt of it. But now, even as hospitals, we are seeing younger population being exposed. Now, also a concept to remember is what is COVID positive and what is COVID disease. A lot of people have got anxiety that I become positive. A lot of people have this fear. What if I get positive? Now, the whole idea is not just to prevent you from being positive. One fine day, 80% of the people might get positive. That is how we might have herd immunity. But what are we talking as COVID disease? This is important to understand, which means the COVID virus enters the body, does all the damage in the lungs, goes across to the various bodies and causes the problem. We discussed that in the previous beginning seminars. We had a couple of sessions dedicated to how the COVID virus is attacking the body, and you can refer to those webinars which are posted. So the important point is that let's not worry about being positive, but we have to worry about having a COVID disease, being hospitalized, needing the oxygen, having to spend a lot of time in the hospital, having to have chronic complications, which means you have certain problems which long standing remain with you. This is that what we don't want. And that is why vaccines is the one to give you that sort of a protection from COVID disease. Now, most people do not get severely ill. This is also very important to understand. Typically, people do recover in about 2 to 3 weeks after getting COVID. And some people do get long COVID, which is when the complications come in. But however, we have to understand the variations which have happened. And we are now talking about Delta. We started with Alpha. I'll show you in a while the statistics. Then came Beta, and now came Delta. So people who are not vaccinated, okay, this is, I'm repeating again now, if the vaccine has to attack somebody, it will find a way to attack. If there are 5 people and 3 are vaccinated and 2 are non-vaccinated, the virus will find an easy way out. And that is the reason when more and more people around you in the community start to get vaccinated, you should take that call and quickly get yourself vaccinated. The virus has no other choice. Of course, some people who have the vaccine have also got COVID-19. Now, remember, mark my words, I'm not talking COVID disease, have also become COVID positive. But out of that, when we see there is a very, very small number of people who had complications, who had to have oxygen. So again, just to clarify that we have to beat the disease. Now, this is the variants that we are talking about. There was Alpha, which was the initial one detected in 2020 December in United States, which was the one in UK. We have about 11% in UAE, which is the emerged data. We have Beta, which was initially in January 21 in States, and then it was in South Africa. We have quite a 39% in UAE. We have Delta, which is 33%. This is the same Delta which created havoc in India. This is the one which spreads very fast. It does not have the same doubling time which used to be for Alpha, which means once it's there, it quickly spreads across in the community setting. Getting exposed to that person makes you at a higher risk for getting the COVID disease, okay? So this is very important to understand. Now, Dr. Hafiz talked a lot about this vaccine, but let me just simplify what is the vaccine like? What is it made of? Now, if you have a virus, you have to imagine it as a structure. I've shown the figure in the center. It has a genetic material in the center. It has a core, it has an envelope or the cover. So either you give the vaccine or which produces antibody against the cover, or it's against the core, or it's against the genetic material. That is exactly the same when we talk about, we have Sinopharm, which is a full virus which is killed and all the components are injected. That becomes Sinopharm. If it is just the genetic material, you pull out the genetic material and you have antibody fighting against the genetic material, you have mRNA, which is your Moderna and your Pfizer. And then if you put this whole envelope into another virus and then give it as a jab, it becomes your viral vector vaccine, which is your Johnson & Johnson or your AstraZeneca. So, but more important to understand is that anything that we do, any jab that we take, it should do its job. It should do the job to make these antibodies, and not just antibodies. There are also many, many cells in our body fighting against the infection. And these cells have to be activated. They should understand that, I remember this. Let me give you an analogy of a CCTV camera. For example, in a security system, if the CCTV is installed and the CCTV is given as an artificial intelligence algorithm that a person who looks X has to be captured, automatically when the CCTV sees the footage, it will pick up the person looking like X. Exactly the same thing with the vaccine. So whenever these COVID types enter, now it can be the genetic material, it can be just the cover, it can be the full virus, the body knows I have to attack it. So this is the mechanism, okay? Now, most of these vaccines are emergency authorized. There is a lot of controversies around the travel. European Union has not accepted Sinopharm, while WHO has accepted Sinopharm, Pfizer, AstraZeneca, Janssen-Cilag or Johnson & Johnson, and Moderna. Now, a lot of people ask, can I take one vaccine and then take another one? That is called mix and match. So that means you take one dose of, let's say, Sinopharm, and you take a second dose of Pfizer. This is currently not authorized as a practice. A lot of trials are going on it, but you and me are not supposed to do this. Whenever we pick and choose a vaccine, and I'll tell you which one do you choose, you know, now that we have the option of taking Hayatvax, we have the option of taking Sinopharm, we have the option of taking Pfizer, we need to understand once we pick up one, we have to follow the dosage schedule. You take dose number 1 and you take at 3 weeks, maximum up to 45 days, dose number 2. There are some trials which have said if you prolong, you get a better response, but currently we don't want to experiment. We want to go by the standards, what has been prescribed to us by the Ministry of Health and other things in UAE. So it's very important for us to understand which one to pick. And when do I call myself vaccinated? Now, this is often a myth that, oh, I took one dose of vaccine and I am vaccinated. Absolutely no. You need dose number 1, you need dose number 2, and then you need 14 days up minimum to call yourself as vaccinated. This is the time your body is producing all the agents fighting against the virus. So this is important. Which one will you choose? We will come back to that in a couple of slides later. These are the ones which are available. We have Hayatvax, Sinopharm, as well as Pfizer. Now, when I say, will this vaccine work for me or not? This is a very important thing. A lot of patients come to me, and even in the clinical setting, they ask, well, doctor, how will I know if I am the one who will get protected if I take this virus? And how do we know that the vaccine is still safe? Now, remember, it goes through these phases for us to understand the safety and the efficiency or the effectiveness. Now, we have already crossed all the trials. What Dr. Hafiz showed, X number of vaccines have already gone through these phases. And what has come out is the efficacy, which means effectiveness. Let me explain this in the setting of either a Pfizer vaccine or a Moderna, who says that 95% effectiveness after taking the vaccine, which I'm talking is 2 vaccines at the prescribed interval after 14 days. So what happens is, if you take, let's say, 30,000 people in the trial, this is exactly talking from the trial, and 95 people out of those people got COVID, okay? Out of these people, if we see how many were vaccinated and how many were not, we will understand the effectiveness. So when they say 95, Out of these 95, only 5 were the people who were vaccinated, while 90 of them had only taken a placebo, which means a normal saline, not a vaccine. So this is important to understand, which means my vaccine can give me 95% protection to get COVID-19. Now, this is one step, but the second step is majority of the patients who do get COVID do not land up being severely hospitalized or having death after the vaccination. So this is another important data. And that is why a lot of people come and tell me, but I took 2 doses of Sinopharm, I'm still positive. I took 1 dose of Pfizer and I'm positive. Now you have to understand that 1 dose of Pfizer does not mean you are vaccinated. You can still become positive. If you took 2 doses of Sinopharm, we know the efficiency or effectiveness is about 70%, which means you still have 30% chance to get infected. But what happened? Did you become hospitalized? Were you able to fight better? Was your body able to generate all the good things that are required? That is an important question to answer. So I hope this clarifies a lot of doubts regarding why you should be taking the vaccine, for what reason. Now, safety, let me put this very, very succinctly, that there is no contraindication. That means no disease where you cannot take the vaccine, even if you have heart disease, kidney problem, brain problem, spine problem, you name a problem like arthritis, for Pfizer, because a lot of trials have been done on these mRNA Pfizer vaccine. So also holds true for AstraZeneca, but AstraZeneca, some people have got clots. Now I'll talk about that as well. But before that, for Pfizer and whatever the trial results that we have are even positive for pregnancy. It is also safe in pregnancy. It is also safe in breastfeeding mothers. It is safe for any other disease that you have. Now, remember, so many millions of vaccines have already been given. We are not at the start of the pandemic. We are fortunate. We are at the 15th month when we have a huge data backing us up. We have umpteen number of trials, all the post-vaccine surveys, surveillances, and everything is being published. And I would recommend, please don't go by the lame media or any media. Follow properly scientific details and guidelines when it comes to your choice, or speak to any one of us who can guide you. If you're a patient with us at Rock Hospital or any other, talk to your healthcare provider. So only 2 people, if you had the allergy to a vaccine, or if you had the allergy to any of the component of vaccine. Vaccine is not just this virus which is dead or the genetic material. There are some diluents, there are some other stabilizers, so many things go into making that vial. So if you had the allergy to that, that is the time when you don't take. Otherwise, my friends, again, my request that you can take, and you will just experience a mild reactions. Talking about the clots, which was a big, huge topic in the media, that it's a very difficult name to pronounce, but I'll try. Vaxzevria is the name of the vaccine from AstraZeneca, which was from Oxford, which was producing more clots in the leg, clots in the brain. But look at the number, 25 million doses later, you had about 50 patients suffering from that. None of them were serious. They all recovered. It was due to falling of one of the agents called platelet in the blood. So this is important to understand, that it is not of concern or of worry. Yes, if you do take a vaccine, obviously you will have little pain in the arm, you'll have a little bit of headache, you will feel tired, you will feel vomiting, some people get diarrhea, but these all in a way is good, because that means your body started to react to the antigen. If your body did nothing, the chance of your antibody, what Dr. Hafiz was talking about, the chance of fighting it, really, did it produce something against the cover? Did it produce anything against killing it at the mRNA level? Possibly none. So it's okay to get these symptoms. Simply take a paracetamol or a Panadol and you should be fine in 2 days. Okay, so don't worry that virus is going to give you something. That's not going to happen. So let me talk about, because this is the myth to facts, right? So I had COVID disease and I don't need to take vaccine. My dear friends, this is a very, very important myth. If you had COVID disease, It was mild to moderate, which means you came out of it well. Most of the people who are listening to us are excellent survivors out of the thing. You need to take it after 3 months. And if you had a severe COVID, possibly after 6 months. But you have to take the prescribed 2 jabs. Very important. I'm planning a pregnancy, and that's why I will not take COVID vaccine. I have heard a lot of patients coming to me and talking about this. Now, remember that all the tablets and the vaccines and everything that we talk for pregnancy, what are we worried about? We are just worried that our baby is safe. We are worried that the baby develops normally. Now, even without taking any of this, the chance of baby having some problem is about 2% in the community. Now, you are not adding to any of that chance by taking a vaccine. It's been proven. The number of the cases which was seen in the Pfizer registry have said that there is no worry or concern even during the pregnancy to take the Pfizer vaccine. So I want you to again understand it's a myth, and let's overcome this myth. The same thing holds true for breastfeeding as well. A lot of people come and say, I have a heart disease, I have diabetes, I don't need to take. This is where you have to understand that this is the thing for you. You are the vulnerable portion in the community. You are likely to get a severe COVID, so please take it. I have epilepsy. A lot of my epileptic patients come back. Epilepsy means fits or seizures. You have to take. Pfizer has been proven to be safe and effective also in diseases like this of brain and spine. I covered pregnancy and breastfeeding. And again, children, a lot of people come to me and say, no ways, we are not giving this to the children. It is experimental. We cannot risk our children. I want you to think, how many vaccines have you given for your child from the time the child is born? The day one itself, you shot a BCG. Why are you never questioning those vaccines? Because you know it's been going on for many, many years and you feel safe. The same thing, if there has been some tests in a particular set of individuals with a set of vaccines, you can extrapolate that this vaccine is also going to be safe. And that is the reason why most children from 12 and above has got a green signal for Pfizer. So you can definitely take Pfizer for these kids. A very interesting thing, I can remove my mask if I'm fully vaccinated. Now, this is again a lot of controversy between the countries. I'm sure you would be seeing, I'm just watching Wimbledon and most people have not been wearing the masks if you are observing the game being played. Now, remember that you still, that is my personal opinion as well, because you need to protect the unvaccinated people in the community. Until every single person gets some form of protection, either by having a disease and then by adding a vaccine or by getting a vaccine, you are still risking other people's life. So you may not be wearing for yourself, but it is prudent and it is important. And the second reason being, you may have another variant. So you got an X variant, alpha variant immunity, but what about the Delta variant? If your vaccine was Sinopharm, which has yet not been shown to be very effective against the Delta, you are still risking yourself. And that is the reason my suggestion and my personal this is, I think we are a long way from removing our masks. Masks have time and again shown to be protective. Social distancing has been shown to be effective. I discussed in my previous section, and I'll repeat that whatever the load of virus that you get, X number of the contents of virus, proportionate is your disease. So if you have a barrier, the chance of that number of X is reduced, which is where you can get protected. Blood clots, I already discussed that blood clots are happening. Now I want you to follow, I will be posting these slides and I want you to follow the correct guidelines and measures as you are reading this. This is all present. I've mentioned a reference. Do not follow any other guidelines. Now, a lot of people also come back to say that Pfizer, we heard that it will affect my generation. My generation can have a problem because it is genetic material. Well, it is a complete myth. mRNA does not affect our genetic material. So get rid of that myth. Vaccine can give me infection. Dr. Hafiz very clearly mentioned, no, it cannot give you infection. It cannot replicate. It is a dead component. It is only one component. It should be full virus to give you the infection. So don't worry, it cannot give you infection. It is experimental. Yes, it was, and that's why it was previously, but now under emergency authorization with so much of data, this is not the case, okay? And it is a new technology. I don't want to take risk. Now, well, this is the mRNA vaccine is new, but the technology is very, very old. With Zika virus, with rabies virus, flu virus, we have tested this time and again. And even if you get pregnant, it's okay, even if you had taken the vaccine. So coming to the questions, particularly who have answered or who have asked in this forum, should you take a booster? Let me spend 2 minutes here, and this is going to be my last slide before we open up the questions. When would you need a booster? Now, as we know, how long do we get protected after full vaccination? We don't know yet. We are safely assuming it's about 6 months. So once we finish taking 2 doses of whatever vaccine, let's say in the month of December or January, you took that, after 6 months, you can safely, effectively revaccinate yourself. So the duration is 6 months, which is proposed also by Ministry of Health, and which is what we follow here as well. So once you finish your vaccine, get your 6 months and then get a booster. Now, is 1 dose enough for the booster? Is 2 doses or complete vaccination enough? There are no trials. There is no hard and fast thing which we know until now. That is where your antibody testing can be of help. So if you finished vaccine in the past as a 1 course of vaccine, you can now, after 6 months, have your first dose. Check your antibody, which is not going to be just simply against the envelope. Okay, I said there is also something inside called genetic material. Check against a complete neutralization. Is your antibody enough to fight the virus? If it is there, then you are good to go. No need for the second one. But if it is not there, that is when you need the second dose. Even before taking the first booster, if you want to check, let's say you are at 5th month of your Sinopharm vaccine, you took Sinopharm vaccine in January, get your neutralization test. You will come to know if there is enough protection there in your body. It's like petrol. Analogy is like if your petrol gas is out in your car, what you need to do is you just need to get into a gauge and a meter and check if it's there enough. If it's not there, you just refill. Exactly the same way. If it's not there, just go ahead and get your booster dose. You can take Pfizer after you have taken completed course of Sinopharm, but at this point, don't mix Sinopharm and Pfizer. Don't mix Hayatvax and Pfizer. At this time, refrain from doing that. Okay, unless it's a very, very exceptional cases. This is not the practice to be done. A very quick word, Dr. Hafiz touched on this, and since we have it in RAP Hospital, for the benefit of all, we have this monoclonal antibody, the same thing which I'm continuously talking, which means you need something to cap the virus. You can also inject it IV once you become positive. Within the first 72 hours, you can kill this virus by giving this through your veins. And this is what is called as monoclonal antibody. We have Regeneron, we have Bamlanivimab. Since the strains are changing, the antibody is also updating itself and helping to fight us against the virus. We have it in the hospital, but it has to be given at the earliest. Do not wait for it. It should be very mild disease. You should not be on oxygen. You should not have had any other issues related to the lung. Then you are safe to take. And if you took this, wait for 3 months after you can take the vaccine. I hope that clarifies most of the things that I had to say. And thank you very much. We'll be very happy to answer any questions pertaining to this. Thank you, Professor, for invitation.
Dr. Shweta, brilliant as always. Brilliant as always. Thank you so much. So informative. You have certainly cleared all my doubts. And as I can see, you have cleared all the doubts and all the queries that came up in the press note this morning. However, I can see that we have been besieged by questions and questions and questions. And now to manage this, we have our very competent Dr. Wilku. Dr. Wilku is the Chief of Operations of Arabian Wellness and a prime mover in this webinar. Dr. Wilku, I hand over to you, sir, to help us to get answers to the many questions that have flowed in. The floor is yours, Dr.
Thank you, sir. Thank you, Professor. First of all, thank you very much for Dr. Hafiz and Dr. Shweta for putting up technical and things in a very simpler way. I would like to quote one sentence which Dr. Shweta mentioned. Vaccine is not to prevent being positive. It is being preventive to being from COVID disease. It's a good quote that she has taken. So that's why because it's connected to many of the queries we come across. Like I got vaccination, after that vaccination I got positive. So these are the type of things which she has already answered. So many of the questions Dr. Shweta has already answered, but I will take few to compile them. Generally we say after vaccination, there are few symptoms like headache, fever, or some lethargic. One individual is asking, I didn't get anything. There was no symptom after vaccination. Did the vaccine work or something went wrong? Dr.
Yes.
Hafiz, you can explain this. And Dr. Shweta, from your side also.
Yeah, go ahead, Dr. Hafiz. You're mute. You're mute.
Yes, thank you. I think Dr. Shweta has already covered this in a wonderful session by her, and it's already told that you need not, if you don't get a symptom, doesn't mean that the vaccine didn't work. Yes, you may get a symptom in the community. Some people may get it, some people may not, but it doesn't mean that the vaccine is not efficacious. So that's why we recommend that in case you are a frontliner, you are immunosuppressed, or you are in a if you are traveling and you want to know your status, do get tested. And the way to get tested is don't go for, because there's so many kits in the community, even we as scientists and doctors don't get confused. So therefore, it's important that go for anti-spike antibodies especially, and the kit which is FDA approved and CE approved, and also go for neutralization tests together. So this will help you to get an idea of your immune status, along with, of course, T-cell immunity. IGRA is a test which we are hopefully launching soon. So this in combination can give you how well protected you are. These are correlates of immunity. They may not be the answer and give you the perfect status, but yes, where you stand. Dr. Shweta, maybe you can add.
Yeah, so everybody behaves differently. We are not all same in terms of our makeup. So some people get very severe reactions. I have had people who were just down for 2 days, and some people never got anything. If I talk personally, for me, I had a little bit of pain after the Sinopharm 6 months back, and that's it. While in the second half, when I took my first jab of Pfizer, I had a lot of headache. I was down for 2 days. So yes, we behave quite differently with different vaccines in a different way. Nothing to worry. If you didn't have anything, it's completely fine. If you had a lot, it's completely fine. But if you want to know if you're protected, the neutralization test, which means not just the cover or anti-spike, but how fast your body can kill the virus, or with how much capacity, is important to be done. Thank you, Dr. Hafiz.
Ma'am, I will add one more query to this, your answer. What should be the level of antibody so that the person can think of going for a booster dose or something?
Yes, Dr. Vaiko. So there's again, this is because these are relative things. When we talk about antibody, we measure a particular amount of blood. And we also, it depends on the standardization of your laboratory, the kit you are using. And there are many factors, and the prevalence in the community, how much percentage positivity is in the community. So therefore, the answer to this is quite, the consensus is that anti-spike titer of 30 and plus, or the kit, sometimes the kit manufacturers may say 15 or 10, but any antibody titer, the consensus among the scientific community is 30 and plus is a good response. If you have, I saw in chats many people having 100 plus and 120 plus. It's a very good response. And I think if someone is not responding, and also the next test is to do a neutralization. Even how much of that 30, how much of that 100 is actually blocking the virus. That's the functional value that's called neutralization test, which it gives you. So just knowing the anti-S may not be the perfect answer, but also knowing the neutralization of that virus will give you a little more information to this. So 30 and above is among the UAE consensus. What we have seen in the medical community is a good response.
Also, I would like to add point here, please do not chase your antibody and get psyched about it. Okay, the antibody is not just the one parameter responsible for fighting the COVID. There is a whole bunch of things happening behind the scene. There are plasma cells, T cells, memory cells, lot of stuff is doing the job behind the scenes. So if you had one course of vaccine, do not repeat it within the 3 months just because your antibody is not there. Please refrain from these activities. So idea is you get a complete vaccination cover at this point in time. You don't even need to repeat after 6 months if you are not a high risk person. Who is a high risk? I explained. You have certain problems with the heart, you have problems with your kidney, you are working in a healthcare setting, you are pregnant. Please refrain from chasing this behavior and also being anxious about it, because that's not what is called for.
Absolutely.
Yeah, wonderful answer, man.
Sorry, I think very well taken. We should not. This is a part of the seminar to convey that don't be in a rush to know your antibody spike titer or neutralization titer. There are many correlates of immunity. One of them is the T cell or memory B cells. So maybe you may have a low response to the antibodies, but you have memory B cells which will take care of it. So yes, so please don't panic for your antibody tests.
Yeah, there is one common question we come across, and even in the chat we have been asked for, like booster dose. If you switch over to another vaccine, say for example Sinopharm, he has taken Sinopharm both the doses, and after the second dose, the person gets COVID positive. The person goes for a booster dose for Pfizer, and the person is taking the third dose also. So that means in last 6 months or 8 months, person has both the doses of Sinopharm as well as both the doses he is going for Pfizer. Is it required, or only one dose of Pfizer or any other switch as a booster is required?
I think I answered this. One booster is enough, but again, for whom? I think if you are high risk, so don't panic that you need to get the second course of vaccination. Second course of vaccination is not required if you are fully vaccinated with Sinopharm. If you are high risk, which means you have all these problems with heart, with kidney, with liver, that is the time when you go ahead and take one. That should be good enough to kick the immunity. Then you test after 3 to 4 weeks your antibody. If it is enough, that can be enough. However, there will be a lot of concerns about travel. A lot of people would not be able to travel, etc. and all. After 6 months, you can safely take 2 courses of Pfizer after Sinopharm.
Yeah, man. So again, connected to this, so the booster dose should be taken after how many months of the second dose, full vaccination?
After full vaccination, you have to wait for 6 months before you embark on the booster, either one booster or a revaccination of with 2 doses. 6 months.
2 doses. Yeah, this is a very common problem people are facing and coming across with these queries. There is one very interesting question. Does the vaccine cause any chronic disease? We have already answered. You have already answered it. Dr. Hafiz has already said vaccination doesn't produce any infection or any disease. But again, ma'am.
Yes, I think Dr. Shweta also covered it beautifully, that hesitancy should go away from us. And as there's a data from it supports this, that our hesitancy is maybe just because it's a myth, and it be with respect to blood clots, be with respect to, some people say that infertility, some people may say that it may cause something, it may cause me positive. You may get positive after first dose of infection, or even after second, because in the community there's a variant going around. It may be Delta, it may be Delta plus, it may be a UK variant, which was not there before. So your body, it doesn't know which. The first time I got positive, I had a Wuhan virus within me. But now I am susceptible to Delta or maybe a UK variant. That doesn't mean that the vaccine is not effective. It just says that you have escape mutants, and sometimes some of the vaccines, some people. So therefore, it's important that we have the mask, we observe the social distancing, and we protect ourselves just to ensure that everyone is safe in the community. So yes, I think that's Dr. Shweta can maybe add on to this.
No, I think you answered it well. There was a question about pregnancy, which is directly to me, so I'll not tell the name, but I think it's an important question for all people related, question related to pregnancy. Do not need to wait after taking the vaccine for being, so no need to use any contraception. Even if you become pregnant, it's completely fine, at least with the data that we have with Pfizer. There is a very big registry. There were a lot of people also on AstraZeneca, Johnson & Johnson, who became pregnant accidentally after the vaccine jabs, and no effect on their fetuses has been documented. It is almost equal to the community, as I told, about 2% roughly. Other than that, nothing has happened. So please, let's get this myth out. There is no need to be anxious or to delay the pregnancy. And even if you have pregnancy, you can still take it. So let's have a very clear consensus on this, because there are a lot of questions which are in line for pregnancy. Dr. Hafiz, anything to add?
Yeah, I think that's a very clear, we should have this very clear. And also the trials now are shifting towards the teenage group and also the pediatric groups, because now we have the confidence that the adverse events or the effects of the vaccine are very few, 0.000, maybe 1 in 100,000 people. So therefore now this vaccination program is also being taken up for the children, schoolgoers, and almost most of the schools are getting their children vaccinated. And this is happening worldwide. So, it's just about safety and efficacy data, which gives us confidence, and we are going ahead in this programs.
The chance of getting a second COVID, yes, exists. It's very low as of now, under 1%, but it's again, as Dr. Hafiz mentioned, one mutation to another. When the change in the cycle is happening, yes, you can get infected with another strain. So it does not mean that you are lifetime protected even if you take the vaccine or even if you get infection. So you have to keep updated depending on what are the strains in your area, which country you live in. I think it's a global audience. So depending on the country where you're living in, you should be well aware about the strains and circulation.
Also, Dr. Velku, one point which Dr. Shweta was very spot on is about infection and disease. Most people in the community are not aware of this concept. Maybe we may have 100,000 people getting positive, but only out of them, maybe a couple of hundreds, maybe in the ICU or having requiring maybe 0.5% or maybe lesser than that. So people should not panic about it. You may get positive, don't panic about it. Take help, take we hospitals, doctors, and of course you have telemedicine. Your friends, but don't go on myths and uncalled myths, because the problem with us is we believe more in our friends who do nothing. Even my family or my traditional thoughts people, it's very difficult to get them in the brain that take the vaccine. So this process, we need to really infection disease, we need to have a clear idea on this. Yes.
You're mute, Dr. Velku. You're mute.
Sorry. Yeah, that's why I quoted Dr. Shweta has already very efficiently differentiated between being positive and preventive from the COVID disease. That was a good quote. There are a lot of questions, but I would combine one set of questions. Like you have already mentioned, Dr. Shweta, you have mentioned high-risk people, those who should take vaccine, and high-risk people who should avoid. In that, you have mentioned only two categories. There is one corrected question because many of the chat is asking about I am taking this medicine and this medicine. Like one patient has individual has asked, his father is on, he's a cardiac patient, he is taking blood thinners and other medicines. So what are the medicines if the person is taking, should avoid vaccination?
Thank you, Dr. Velku, and thank you to the patient for asking that question. Kindly note, any kind of medicine that you are on does not mean any contraindication for the vaccine, which means whatever you are taking, aspirin, clopidogrel, warfarin, anything that you're taking, you can still take the vaccine. Okay, there is no such thing that you have to avoid because you are on a medicine like that. Particularly, I'm quoting Pfizer because we have enough trials and we have enough data pertaining to these subsets or categories of patients. So if you are, that's the reason we said, which vaccine will you choose? So choose Pfizer if you are on these multiple medications, etc. Then no problem at all to take the vaccine.
One thing
Yeah,
to
ma'am.
add, Dr. Wilco, sorry to interrupt. So
Yeah, please. Sure.
mix and match strategies, it's getting a lot of attention. And why is because that, as we know, some of the viruses are killed and some of the viruses are mRNA. So we are checking boxes of different components of immunity. So therefore, it's good to attack the virus from all the sides. And that's why the government is saying, if you take in 2 doses of Sinopharm, wait for 6 months from now, maybe they may come up a guideline, maybe 3 months later on, but then take a Pfizer. So you check another box and you attack the virus more, you get more protection. So that's the whole idea of protective immunity.
Yeah, connected to the previous question, one individual has asked, she is allergic to Augmentin. You have Dr. Shweta have already mentioned a few things. If you are allergic to drugs or some components, so you should be avoiding. So she has asked, she is allergic to Augmentin. Can she take vaccine?
100% you can take the vaccine only if you had a reaction to any other vaccine in the past. That is the time when you don't take the vaccine, or even you talk to the doctor, because we need to check what were the constituents, etc. But please take it. Augmentin does not form a contraindication or a no for a vaccine. Go ahead and vaccinate yourself.
Yeah. There is one interesting question. Is the vaccines available now? Effective on the variants now coming up? Dr. Shweta has given an alternative answer. Even after being vaccinated, we should wear a mask so that we don't know about what variants are coming. We are protected from X variant. Now there are Y variants also. So I think you can elaborate more, ma'am.
Yeah, exactly. So we will never know until when this mutation will happen. And I think there is a question related to, is there any difference in genetic materials of different strains?
Yeah.
So I will just go back to the slide and I will just like to point on what the virus looks like, because this is when we talk of a gene or we talk of the material, what are we indicating there? It is important to know how it looks like. So this is the slide. I hope my slide is visible. It's like the component that you're seeing in green, blue. These are the various genetic components. Yes, whenever a mutation happens, which means one link is broken, some other thing gets there, and then you have a new strain or new viral variant which comes into practice. So that's why, yes, genetic material of each of it is different. And that's why if you are seeing on your left side, you have B1.1.7, B1.351. These are all the actual genetic material components which is being written here. So yes, very much genetic material can vary. And this is how we classify the variants. I think very soon one variant called Omega is also going to come. There's already Epsilon, Eta, Iota, all the Greek alphabets. I hope and pray that before we exhaust all the alphabets, we are able to get the COVID pandemic under control.
Yeah, ma'am. True. Ma'am, there is one question. What type of antibody test to be taken before the booster dose? So there are two types of tests which you are mentioning, Dr. Hafiz was mentioning. So what do you suggest? What test should be done before going for a booster dose?
So neutralization is what Dr. Hafiz has said, that do anti-spike as well as your neutralization ability. Do that and you will come to know if it's 30 and above your anti-spike and also the capability to fight, then you don't need to take the booster.
Yes, Dr. Wilco, again, just to carry forward this question.
Sure.
This is like influenza, and we know the virus is mutating. So there is a cocktail concept which is coming, and sooner we will see that the vaccine would be yearly, or maybe you may have to take these jabs on yearly basis based on the variants which are prevalent in that area, and this may be coming soon. So as the virus evolves, we have to also make sure that we are protected. One new thing in India, if you see today's news, there's a Zydus Cadila has launched another new vaccine, which is called,
Right.
I actually had the slide, but I didn't get the time. So it's an intradermal vaccine, and it has 3 shots. So, and it can do what's an auto injector. So you can just, the time of vaccination for each person will be less. So there's going to be new tech, and this is a DNA vaccine, which it was not there before. We had RNA, we had, inactivation vaccines, but this is a new group of vaccine. So these technology will improve and come to us again and again. And but at the end of the day, we need to ensure that till the virus is gone from among us, and each of us have at least some level of protective immunity, we need to wear masks, we need to follow the social distancing. And of course, even one concept, which is the black fungus, which is there in India. And we have a lecture coming with Dr. Arun Lok from PGI. And what he says is, even though people are negative, they need to continue to wear masks because the fungus spores are there in the air. And they can inhale those spores and because you are taking corticosteroids and your immunity system is already knocked down after COVID, you may get black fungus, what they call it. So therefore, it's very important that you wear the mask and not take yourself loose that you're taking this 2 doses, as Dr. Shwet said. You're not protected just because you've taken the 2 doses. You need to be at guard because the virus is smarter than you.
Yes, and also no vaccine, no protection can be 100% specific. So it's never, no vaccine is going to give you 100% protection. So it is all about all of us getting some little protection at some point, that when the pandemic will come to an end and the virus will have a dead end. Essentially, the virus is right now very furious. It got attacked from the vaccine. So now the virus does not like it. It's changing its shape. It's changing its structure because it wants to be alive as well. It wants to be alive in you, in me. So until it finds a dead end, when it cannot do anything, that's coming the pandemic, when we can call officially the pandemic to be ended. So until then, please carry on these activities as we are doing. This is a new normal. And the earlier we accept it, the earlier we will be at peace, at ease, and for the benefit of people and world at large.
Yeah. Thank you, Dr. Shweta. I think we have covered almost all the queries which we have been asked, and you have also mentioned many common myths. So if any other queries are there, please post in the support mail. We will be happy to reply for you. And Professor Kennedy, over to you.
Thank you, Dr. W. Thank you so much. And this must certainly rank as one of our most valuable webinars. We've had 8 webinars, and I cannot choose between my children as to which webinar is better than the other, but I can definitely tell you that this webinar is very, very valuable. I want to thank both our speakers, Dr. Hafiz and Dr. Shweta, for their excellent presentations. They certainly cleared all my doubts, and I'm quite sure that they have cleared all our listeners' doubts. However, as Dr. Wilco did say, that in case you have any further queries, please send them in to our website, and we will ensure that we answer these questions. Now, I want to thank Dr. Shweta and Dr. Hafiz for their brilliant presentations. Thank you so much. You have done us a great justice, not only to the audience that has listened in, but also to the audience that will see your videos when we upload it on our website. Thank you so much. I'd like to thank the team. I'd like to thank the team that made this possible. This is a young organization called Arabian Wellness. We are wellness professionals, and we are so grateful to be part of RAC Hospitals, and we manage the COVID rehab on-site program or online program. So I'd like to thank my team. I'd like to thank our audience. We have a faithful audience that comes in webinar after webinar, and our audience runs into the hundreds and from different countries. Thank you so much for having the confidence in our webinars. Our next webinar will be held 2 weeks from now, and our topic that we have selected at this point is post-COVID hypertension and its management. This will be on the 17th of July 21. And with that, ladies and gentlemen, my thanks once more to everyone, and I wish you all a great weekend. Thank you so much and good day.
Thank you. Thank you. Thank you.
Thank you,
all.
sir. Thank you.
Thank you, Dr. Velgu. Thank you, Dr. Shweta. Thanks for the audience. Wonderful session. Loved it. Thank you.